Hello, my name is Dr. Mitali Joshi. I am a physician, diabetologist and clinical metal toxicologist based in Prabhadevi, Mumbai. Today I am going to start a topic which I've had a lot of fun compiling for you. It is about the common myths we as physicians come across when treating patients with diabetes. We get a lot of questions from patients every day which are irrelevant. We laugh at those questions, but they're actually real questions for those patients. So I'm going to tackle this one by one with firstly patients who are not diabetic about how they react to diabetes, patients who are on treatment, what they think about their treatment, and common food myths that we have every day. So first one is diabetes is caused by eating too much sugar. Let me clarify, diabetes is not caused by eating too much sugar. Too much sugar can be one of the risk factors leading to diabetes. When you eat too much sugar, it is metabolized, converted to fat, you tend to put on weight with that, and that is what can lead to diabetes. Second factor is when you have too much sugar, it is a pro-inflammatory substance. It can cause a lot of inflammation in your body, and that is what can lead to diabetes as well. But per se, eating sugar, sweet things does not cause diabetes. Second thing, women with diabetes should not get pregnant. This I get from a lot of young diabetics, men, women both, who are concerned about pregnancies and related questions. If I have a young woman with diabetes, I would like to tell her and all my other patients that women with diabetes can easily get pregnant. Yes, the medication changes, the patient has to be on insulin. Nowadays we are also using metformin and other medications as per the case, but pregnant women with diabetes can have a very safe pregnancy and very safe outcomes if they take care of themselves. Then, thin people cannot get diabetes. They absolutely can get diabetes. There is something called a thin fat individual, especially in Indians. So, in thin people, there may be a lot of fat surrounding their organs inside their body. This fat can actually be bad for their health. This is worse than having fat under the skin. So, such people actually tend to get diabetes also as bad as other fat people. Another query is diabetes doesn't run in my family, so I will not get diabetes. Not true at all. We have a lot of people who are first timers who have never had any history of family diabetes, but they have had diabetes with them. So don't think you are safe. You still need to get tested every 6 months to a year. Then diagnosing diabetes. They say that diabetes is diagnosed when people start getting symptoms. Most people get diagnosed with diabetes without any symptoms. They could be going for surgeries pre-operatively, they could be getting their sugars tested and they find that, oh, I have diabetes. Or they could be going for dental treatments. I think most dentists now do not do your treatments until you have your sugars done. That's when they find that maybe they are not very badly diabetic, but at least they are borderline diabetic and they need attention immediately. The next set of myths are about the treatments that we have. First thing, insulin is addicting. Now this is the worst thing I have ever heard. Insulin is a hormone. It is an essential entity in your body. When insulin is not produced in your body, you need to supplement it, otherwise your sugars are never going to be under control. So when you are talking about addiction of insulin, it's not an addicting substance. It doesn't alter anything in your brain. It doesn't make you dependent on it. It is just you supplementing it because it is not there in your body. Most type 1 diabetic patients, mostly children, have to be on insulin always because there is no insulin production. Then, the next myth is once diabetes is under control, you can lower or stop your medicines. I've seen a lot of my patients doing that. Doctor, my sugars were under control. You said meet me after 3 months. I checked after 15 days only. My sugars are fine. So I stopped my medicines. When they come back to me, their sugars are 400, 500 plus. You are on medicines because you cannot metabolize sugar. The minute you stop medicines, your metabolism of sugar will stop and your sugars will go high. Please do not lower or stop your medicines unless your physician has expressly told you to do so. Then, the third treatment dependent query is, can medicines make my kidneys fail? Medicines if prescribed by the physician correctly, cannot make your kidneys fail. They are meant to prevent your kidneys from getting failed. Yes, if you overdose on them, any medicine can damage your body, your kidneys, your liver, your heart, all of those things. But per se, medicines cannot fail your kidneys. Please don't stop taking medicine thinking that something will happen because of medicines. If you don't take your medicines, the diabetes can definitely fail your kidneys. So be careful. Then we have a lot of social media followers. I have a lot of them in my family as well. So they feel that social media has a bigger impact on their treatment than the doctor does. So they get a lot of forwarded messages on whatever social media sites there are, and they start following them. So I have had a lot of patients following funny fad diets. Mangoes are okay in the mango season. Mangoes are okay in the mango season provided your sugars are absolutely in control and you eat your mangoes in small quantities. The same thing goes, I have a relative who has been taking gelatin for knee pain. Please understand, gelatin is kidney toxic. It will fail your kidneys if you take it in large quantities. Do not follow social media trends blindly. Research before you try them. Then coming on food substances. I think this is a vast topic. We can go on about this the whole day. I have compiled 4 or 5 small patterns. First thing people do when they get diabetes is they stop eating rice. Rice is a low glycemic index food. Your wheat has a higher glycemic index. Stopping rice does not make any sense. Yes, different people from different regions can tolerate different foods. So the smarter thing would be try eating your rice, check your sugars 2 hours later. If you see that your sugars are spiking, stop eating the rice. But do the similar experiment with wheat, jawar, bajra, all of those things. So you come to know which foods are actually suiting you. Then the same diet applies to everybody. The neighbor is doing this diet, he is a diabetic, I will follow what he is doing. No, the neighbor's genetic composition is different. Your family's genetic composition is different. So if your father has diabetes and he's following something, it's suiting him, will not mean that it will suit you. Please do not do that. You have to have a customized diet. If you don't understand it, please seek advice from a qualified dietitian. They will help you. Then jaggery and honey are allowed even if you are not taking sugar. I have a lot of patients coming to me with saying that they are taking jaggery in their tea. No, it's not allowed. Jaggery, honey, sugar have the same calorific composition as sugar. So 1 gram of sugar gives you 4 calories, 1 gram of jaggery gives you 4 calories, 1 gram of honey gives you 4 calories. So they are not the same. Yes, they are less harmful than sugar in the sense that they create less inflammation compared to sugar, but they are giving you the same calorie count. So if you eat the jaggery, your sugars are going to be as high as eating refined sugar. Please stay away from them. Low calorie sweeteners are okay if taken in very moderate quantities. So you can stick with sucralose or stevia depending on your taste. But again, I am not very for processed foods. So avoid jaggery, honey or sugar if you can. Then the last one, exercise will take care of diabetes. Exercise is an important part of everybody's schedule. It is not just because you're diabetes that you have to exercise. Everybody has to exercise. Exercise will help your sugars get controlled to some extent, but that is not the final solution for anybody. Exercise is a part of your treatment, not entirely your treatment. Your sugars may not be under control if you're only exercising and avoiding your medicines and diet control. Please do not do that. There has to be a balance between exercise, food, medicines. That's all I want to say about the myths today. We can always discuss some more. If you need any more information, please feel free to contact me on Lybrate. Thank you very much.